Danielle, thank you so much for being here. Let's just first just tell us who you are and a little bit about you.
Awesome. I'm Danielle Squires, Executive Administrator at Vive Adolescent Care. I've been there since we opened, and I was just basically a stay-at-home mom for 20 years and just got kind of dumbed into the situation. I started by trying to just set up billing, and next thing I knew, I was doing all the administrative tasks, and I've learned so much and kind of ended up as a leader, and I love what we do.
That's awesome. That's cool. I'm sure there's like a whole big story too on your journey and
Oh, yeah.
how it came to pass.
Huge story.
We'll start off with, what does a typical day look like?
We are pretty structured at Vive. We really believe that everything you do is therapeutic, from brushing your teeth to making your bed to what you eat. So everything is considered a therapeutic intervention, and we have a great staff, like a super loving staff who spend time making sure that they're doing all of those things. So they start their day with hygiene, and they review the rules for the day, they set goals, they head downstairs, they have their meals, and then they start for a pretty rigorous day of groups. And they're all different sorts of groups, from physical to art to music to therapeutic groups. And we try to keep them busy, but with time for reflection on what they're learning.
That's awesome. So it seems like everything is intentional there.
So intentional. Every moment is planned with a purpose, so that we don't waste any time. I think a lot of times parents feel like we are babysitting their kids to just try to keep them safe. And really, it's so much more than that. Sometimes even learning a little skill like brushing your teeth, which I know sounds crazy, but helps them feel better about who they are, how they're presenting. And so it's all intentional, every bit of it.
That's so cool. Let's just talk about some of the rules and regulations over there. For example, are phones or other electronic items allowed?
No, we try to keep the clients focused on treatment. So the outside world is so pervasive that we just try to give them some space, even to the point that we have them take a little break even from their families right at the beginning. And that can be really scary to the kids and to their families, but it's proven to be so therapeutic just to have a minute to kind of reset. And it takes about 3 days to get used to not having your phone, and we definitely see the effects of kids wanting access to technology. But after that first couple days, we call it the honeymoon period, you can see that they engage in life a little bit different. And so we think it's really important to the therapeutic process, not that electronics are necessarily bad, but just to have them a little bit more monitored. So
That's awesome. Yeah, I mean, I think we are all addicted.
Oh, I know I am. I try to take our own advice. We like train our staff and stuff. You need to take a break from social media. You need to take a break from your phone. And so that we can model that for the kids, that it's okay. You can sit in peace and not have something going on.
That's awesome.
So.
That's great. What's the food like? And you accommodate dietary restrictions and things like that?
We have to accommodate dietary. There's so many things these days that the kids need help with, from anything from religious needs to gluten intolerance and allergies. So for sure we accommodate. We like to pride ourselves in good food, good beds. We think those two things are tantamount to being healthy. And so we don't do regular hospital beds. We have more luxury home style beds, and then our food is next level for reals. Like, we do not spare cost, and we take the clients' suggestions. So they fill out cards of what they like, what they don't like. We make them special meals based on requests. In fact, I just saw a text yesterday come through on our internal texting, and it said that the kids were praising the most recent dinner. And I was so proud of we have a new chef, and so she was working really hard to make sure the kids loved her food, and they all did. They were just raving. So
that's so awesome.
Yeah.
I mean, as a parent,
it's expensive, but it's awesome.
Yeah, but that's like, but as a parent, you know what I mean? I'm wondering about, like, because I think we all have this misconception that Hollywood is painted in our heads about what a mental hospital is like.
Super institutionalized, dropping a thing of beans on your plate. Yeah, I can see what people think, and we really try to go above and beyond on that and make them feel more like they're eating home food. Sometimes we have to be careful because sometimes the kids want too many portions. And so we have a nutritionist that's like, okay, you can have double protein, but you can't have, they're kind of always monitoring that too, so they can stay healthy weight. And
yeah, that's awesome too. I think, even like when you feel bad about what you ate, just the very next moment, can have triggering problems.
Yeah, so that is interesting that you brought that up. We do have a lot of kids that's part of their diagnosis and struggle, and it has a lot to do with either body image or food restrictions and those type of things. And I feel like we've really made a safe spot, including our nutritionist is great. She makes like little adjustments. Oh, do you like this flavor of this? And I will get this for you, and helps them see that restricting food isn't really like a good outcome. But it's also can be a trigger. And so we're also looking for different ways that we can support kids through those types of food struggles.
Yeah, that's great. That's awesome.
Yeah.
What kinds of activities or recreation are offered there?
Okay, so the tricky part about Vive is we're a lockdown facility. So to keep these clients safe, they're so acute that we don't really leave the campus. So we only have a small outdoor area, but we do have some great big indoor areas. And so we have a lot of recreation in regards to basketball, volleyball, like all the things you can think of that you would have in like a high school, basically, is what we have and offer. We have air hockey tables and a movie theater, and there's a lot of options. A computer lab. I'm trying to think what else. Oh, I don't know if anyone's talked about our mind and mood room before. If you've heard about that, we offer a bunch of different like therapeutic interventions, including an oxygen bar and PEMF mats, like electromagnetic field mats, red light therapy, and vitamin infusions. So like cool treatment options where they kind of feel a little bit spa-like too, where they get to choose their flavor of oxygen or, sit in a zero gravity chair and just kind of chill. So they get a little bit of that along with the hard like therapeutic work that they do in groups.
That's so cool. That's fantastic. Yeah. I think being pampered is, it's rejuvenating.
100%. Even to the point we have like scented hot towels and stuff for the kids that are being brought in to kind of just let them wash up and chill, because it is scary. It is scary to be taken from your normal life and put into a place you don't know anybody, you don't know what's going to happen. And so we try to ease those concerns directly with the client initially by doing a little bit of pampering.
That's awesome.
If they'll let us. Sometimes they don't let us, but we try at least.
I think, just thinking about other common concerns that parents might have, and again, this is probably Hollywood coming in and painting us a false picture, but how do you guys prevent bullying or negative influence from, child to child, that type of thing?
This is such a tricky question because it, like everywhere from social media to being in school, our kids are faced with these things. And when you get into like I said, into a facility where there's kids with kids, it's almost impossible to prevent every negative interaction. We do take it super serious, and we have a bunch of different interventions in place. If we start to see bullying, we usually like to have the kids sit down together, like with a therapist first, try to talk it out that way. If it continues, and we have like an escalation process that we say this isn't acceptable, we'll start making distance restrictions, those types of things to kind of keep them apart. Ultimately, because our facility is large, we have the opportunity to switch locations so that if nothing else works, then we are able to at least protect them by moving them to a different group so they don't have to do it on a day-to-day. But really, we feel like a true life coping skill is learning how to deal with people who are bullying you. And what are you, yes, it hurts, and yes, it's horrible, but what are you going to do about it? So we also try to go heavy on coping skills. Like, what can you do if someone's bullying you? This is a great opportunity for you to practice. We are a microcosm, a place to practice so that when you get back out into the real world, you're going to have the skills you need to really make a difference in how you react to things.
That's so awesome.
Yeah.
And I think that's a cool approach. I mean, it's like you literally can't force anyone to do anything and stop anyone from, you have no idea what's, a person's mind. But now how do we deal with that when that happens?
Right.
Because it's going to happen. It's inevitable.
The funnest, maybe fun is the wrong word. the maybe most satisfaction I've gotten is when you're sitting with a client, and I don't get to very much, I'm an admin, so when I get to, it's a real treat. But when you sit with a client and they are debriefing what happened, and they're kind of doing a play-by-play on what they could have done different or what would have helped, and just kind of taking their own accountability, which is so huge. It's so easy to be like, that person mistreated me. It's a whole nother level of awesome to see a teenager, you know, underdeveloped so far, you know, they're not adults yet, and they're using these processes and these techniques to learn how to like reset, look at what I did and what I can do better next time. And to me, that's so powerful that they can have even just a verbal discussion about, okay, yeah, I should do this different, or I should have talked to a trusted staff, or I should have, you know, it's powerful.
That's cool.
And I don't know if they usually get, like, I know out in the real world, my kids don't get to have like someone kind of handhold them through every negative situation they run into. So again, it's like a practice in a safe environment. They get to practice these skills.
And like having like a coach like right next to them the whole
right
time.
next to them. Like our staff are everywhere and they're there. And the cool thing is they care. Like every person I get to hire, so I know every person, I know their why. And you almost have to have a why to work in this industry, just because it can be really heavy, and you learn the kids' backstories and you're like, oh my gosh. And so the people that work there want to work there, and they're working there for the right reasons, and they're giving really of themselves to try to be that coach and mentor and to model good skills, which is awesome.
That's so awesome. That's rad.
The really rad is like we have at least 3 employees who used to be our clients.
Oh, really?
Yeah. And I think it's amazing. They show up in their suits to interview and they want to do it because someone did it for them. I think that's insanely awesome.
Yeah, that's like, I mean, that says, I think, a lot. And that parents even seeing this interview, they can gain confidence. Wow, this is a place that's so good that they actually want to go back, you know?
Yes, I think it's amazing. In fact, we've even had kids, not kids working with us, but kids stop by and they'll be like, I'm headed to my interview, or I just made the soccer team, and they come back to let us know the outcomes. And it's so powerful. I love it. That's why I work there.
And that's amazing.
I started to help and now I'm there for the outcomes.
Yeah, how can that not be addicting?
Yeah, it is.
That's cool. Painting a picture for, common questions that parents might have. How do roommates work there?
So the state requires us to have some pretty strict regulations on rooming. So they have to be within 2 years of your child's age. We're pediatric, so we technically can take 11 to 17-year-old, but maybe an 11 and a 17-year-old shouldn't be in the same room. We try to do kids that kind of have similar interests, or that have already kind of established that they're okay together. But also we've had kids that you thought, oh, these will not work. And once they get to be roommates, it's like things change and they mentor each other and they build each other up and become each other's best defenders. So it's tricky because kids want, they want to have a say, and I get to be in a room with my friend. They want to have a say in it, and ultimately we make that decision. But most the time it turns out just great.
That's cool.
Yeah.
How are privileges earned there?
So we are not privilege based. So everybody has the same privileges. We do have a level of care that is, after you've been with us for a while, we call it Strive, that after they've been there for a while, they have access to like rooms like the computer lab, or we have like a gym that has some pretty intense equipment, things that may have not been safe for them when they first admitted, but now they've kind of worked and they've proven that they're making progress. And so we open those rooms to them. But when it comes to like, I don't know, I can't even think of any privileges that we would restrict or from one person to the other. We're just not privilege based. I know a lot of programs, they say, once you do this, you earn this. And we're just not. We're working with every client. We're kind of meeting them where they're at, and we're building a treatment plan that's for them. And so it looks different for every kid that we have there.
I think that's great. I think it
has to be that way.
Yeah, huge relief too. You know what I mean? Of like, hey, now they're going to put in a hierarchy or whatever it is, and it's like, that can cause more trauma or
Oh, yeah.
or trigger, something.
Well, and everyone comes with their own set of issues, and some people may not be able to read as well, and so they can't do the level-based homework or whatever it is, and we just have to meet them where they're at and help them feel confident in that they're making individual progress towards the goal.
That's awesome. I love that, meeting them where they're at.
Yeah.
I think that's awesome. All right, how do direct staff manage high acuity behaviors?
This is probably one of Vive's trickiest things to teach, and this is why. When there's a high acuity behavior, people know how to respond. When clients or kids are on their baseline and acting normal, people know how to respond with love and support. People know how to intervene when it's high. The tricky part is that middle ground, when you can kind of see them starting to escalate. We are trying to prevent high acuity behaviors by training our staff really rigorously on how to do mid-level de-escalation, to observe behavior changes and to intervene sooner so that ultimately we don't get to those high acuity situations. And it is tricky because it requires a different kind of work. It requires a relationship. It requires being super observant, and it requires time. And sometimes when you have a couple staff with multiple kiddos, they just kind of babysit the group as a whole, and we're trying to get them in tune with each kid individually and understand what their baseline is and how you can intervene sooner. So that's our main focus. Obviously, they're trained on how to safely handle super acute behaviors. So if someone is self-harming, or if someone is harming others, or if someone's doing extreme property damage and being unsafe, they know exactly how to intervene, and they'll do it swiftly and safely. It's that leading up to that point where we do a lot of the hard work, and it takes a lot more training to know how to do that. We want to stay away from those acute behaviors. They happen, and they will happen. But we're really trying to train to intervene sooner and find out what the client really needs, what the kid really needs.
That's cool. I think that's like, the magic trick if everyone could figure out for their own kids too.
100%. And it's a lot of understanding yourself, like what your triggers are, because what happens is these kids are sometimes masking fear or other things with anger, and so they'll act out with some pretty objectionable behaviors. But an objectionable behavior isn't the same as a behavior that you need to intervene immediately. It's something you need to work through. And I know that, like, if someone does an objectionable behavior to me, like, for example, calls me a bad name, my blood pressure, my everything starts to rise too. So it's a lot of training the staff how to know what your triggers are, let them be in the other room, stay professional. This is, you're helping them. This isn't about you, and not getting worked up with the clients, being a solid object for them, basically.
That's so cool.
Yeah.
That's awesome.
We have something that's called the 3 Ps, and it's not like a 3 strikes and you're out, but it's like we will give you 3 different people to interact with to try to de-escalate, and we want to give the client dignity and use other people's relationships. So if it's not working with me and you, Zane, I'm going to pull someone else in and let them see if they can work with you. So we train them that first, like go through multiple people before you start escalating a situation, like have them work through it. Their relationship might work when yours doesn't, and that's okay.
That's cool. And sometimes yours will, and then someone else's doesn't.
Exactly.
We've kind of gone into it a little bit, but what training do direct care staff receive?
Awesome. So they do, obviously we just have our organizational policies, and they are trained on that, like at orientation, but we also do really deep things called, and one we call it boot camp. And it's like where we put them through every situation that potentially could happen, and they actually get to engage with the clients with monitoring on what to do in these situations. The other one we do is a behavior management training, and it's called Handle with Care, and that's a nationwide behavior management. It's outside of Vive, but we use it because just like the title says, it's called Handle with Care. So we aren't using any pain compliance. Everything we do is for ultimate safety for the client and for the staff. We are not there to injure anyone or to throw anyone down or take anyone down. It's all about a therapeutic hold. And the cool thing about it is it uses technique, not like brute strength. So I do PRTs, like I do the holds, those Handle with Care holds sometimes. And my personal experience with them is that they are therapeutic. The client starts out so dysregulated, they don't even know how to get back to a locus of control. They just don't. And they're reaching out for someone to help them. And you actually put them in this hold, and it is almost like compression for them. I have seen staff rocking a client, or letting the client's head leans back on their shoulder. It's just, it can be so therapeutic. So a lot of people think it's like, oh, they're acting out, and so you take them down, and it is so far from that. Every time I've personally done one, at the end the client is like giving me a fist bump, or they're like, I'm sorry that happened, and then you get this cool opportunity. It's the coolest opportunity to say, so what are we going to do next time? And they get to process that with you. So you go all the way from self-harm or harming others. You're up in this really horrible space, and you get to come all the way down to like, thanks. It's insane that can happen. But that's why we use that specific behavior management, because it really does handle each client with care and give them dignity.
That's fantastic.
Yeah.
That's cool. Is there any other points of training that you want to talk about that you didn't mention?
I think that we're constantly training. So we get to like review incidents, and then we come back and we retrain the team on like, hey, this is what went wrong. This is how we're going to do it moving forward. So I think our team is not afraid to admit when they've made a mistake even, and then we get to take it and turn it into growing so that we do it better the next time. So we have like 4 big trainings a year. They have to be recertified every year. They're constantly being trained. Basically.
That's awesome.
Yeah.
I think that puts a lot of people at ease.
You could never be trained enough, I don't think. And you have to consistently be doing it. But I hope that it would put people at ease to know that not only do they care about you, but they're constantly being trained on the best ways to intervene.
You kind of mentioned some of this.
Okay.
But what de-escalation strategies are taught?
Okay, awesome. So we have a bunch of different tools that we give our staff. Some of those things are like, you take a break with them, or you do something called social redirection, where you redirect them to something different and hope that is just enough of a switch in what's going on that it'll bring them down from whatever they're doing escalation wise. Our staff are getting really good at it. They'll notice and be like, hey, do you want to take a break with me out here? Or, hey, do you want to maybe spend some time listening to some music? Or you want to color for a minute, and then we'll go rejoin the group. Sometimes that's all it takes, is just a little redirection, and then they can kind of take a deep breath and restart and get back into what they need to be doing, which is the programming or the therapeutic work.
That's cool.
I will talk a little bit about posturing and proximity and positioning. I don't think we in our daily lives realize just like how you stand or where you stand, or if the client is sitting and you're standing up and talking to them in their face. It's all about creating what feels safe to the person who's de-escalating. If I get right up in your face right now, it's not going to feel comfortable, or if you're already frustrated and I'm like, come on, it's all about kind of reading the room and that proximity. So we actually do significant trainings on where your hands go, how you stand, where you stand, so that you're not ever doing anything that would elicit the kid to think that you are being aggressive to them, or that you are trying to exert some sort of control over them. You're trying to work with them, not against them.
That's cool. Well, let's talk about building rapport with resistant teens.
Yeah.
Stu talked about this a little bit.
Okay.
Talk about some of the strategies that you guys implement, because this obviously I think is probably the number one ground, foundation for all of this.
100%. Our staff are not therapists. I'm not a therapist. Like, I don't have the training and technical knowledge to learn how to establish a professional therapeutic rapport with the client. What our staff do have, though, and what I've previously mentioned, is a lot of heart. And they are interested in these clients, and they will spend the time and effort to get to know their stories. And once you kind of do that, it feels like even resistant teens, a lot of times they'll put up a facade or a wall a little bit, like, yeah, you're not going to get into me. And then the next thing you know, they're like, hey, talking to the staff about their football game or whatever it is that they've already built rapport on. And I have seen resistant teens pretend they're resistant, but they're really not being resistant. And part of that is understanding that they're a lot of times masking. They're masking for whatever's going on. They're trying to present that they're the strongest kid in the group or whatever it is. But really, you guys can see through that, and you can see that they're ultimately hurting. They're ultimately struggling. They just need you to know that you're going to be there, whether they're mean to you, whether they're nice to you, whether they talk to you, whether they don't. You're just always a solid presence for them. So I would say every client that comes to us is resistant in some way, shape, or form. And we're having awesome outcomes. And at the end, they fill out like a survey, and they talk about which staff inspired you. And not one client has ever said none. And that's kids that are leaving still with struggles, but they're still listing the people who made an impact on them. And that's insane.
Yeah, that says volumes, I think.
It does.
How is the unit monitored overnight?
So we are staffed 24/7 with nurses and care staff. The care staffing ratios drop down a little bit, so we have less care staff overnight. And I should knock on wood, we've never had an incident after midnight, because once the kids are asleep, it's smooth sailing usually. But we have a nurse on each side, and then we have at least one staff to every 10 clients, basically. So
that's great. That's awesome.
So they're consistently monitored, video monitoring too, not in bedrooms, but the unit itself. So nurses in the nurses station can see if someone's coming out of their room or things like that.
How do you transition teens safely?
So there's multiple definitions of transition. If I was talking about transitioning them from location to location within our facility, we do a lot of talking to the client, making sure they know what the expectations are, what's going to be happening next, 2 staff presence, making sure that they don't have anything, they're not taking anything with them that they're not supposed to take. But mostly it is like sometimes our entire treatment team, which is like a therapist, a psychiatric provider, a nurse, will all go and talk to the client together and be like, hey, here's the plan today. We're going to move you from here to here, and here's the goals. And I think that sets an awesome precedence that we're not just moving them around, but that you've got a whole team behind you that is rooting for you, that you will, and they usually will kind of concede and try to be safe because they've got this whole team of people that are like with them, and they'll be like, okay, I'll be safe, which is awesome. I love that we do that. I think it's our secret sauce. If you want to know my honest opinion is that we have this same team that takes you through multiple levels of care all the way to transitioning home. And that is powerful. I don't know if it's been talked about, or I think a lot of parents who have a kid that has a crisis, they may not know what treatment options look like and how we're different. But the standard is if, for example, if my child tried to commit suicide and I take him to the emergency room, they're in the hospital for 3 days. They get him medicated, and then they send him out and say, okay, now go find a therapist and a psychiatric provider. And it's almost like you're starting from scratch. The cool thing with Vive is that you get to go inpatient. That same team that gives you those medications on the front end is monitoring that they're effective. They're making little adjustments. They're taking you through that level of care, then the level of care with your therapist. Then you even get to be there with us during the day and go home at night as you're getting towards the end of your treatment. Where else would you get that? Where an entire team stays with you all of those different levels. That's what makes us different, and that's what makes our outcomes better. Like our outcomes, this industry standard is readmit for a mental health crisis is 49% readmit rate. Ours is 14%.
Wow.
We have to be doing something right. We have to. And I think a lot of it's that we are watching it more closely. We're not just prescribing and sending them on their way. We're watching it for a good amount of time.
That's cool. And it really, like, I think of the saying, it takes a village,
100%.
And I think it's cool that you guys, gather around an individual like that.
Yeah.
They know that they have support from all around.
Well, and we did it for our community in the first place. Like, our community was underserved. Now we're serving nationwide. Like, we get people from all over the nation, and partially because of our outcomes, but partially because we're doing something different. They can't find it. They can't find that help. And parents get to a point where they're like, I do not know what to do. I've had people tell our admissions that it's the first night of sleep they've gotten because they feel like we're keeping them, at the bare minimum, keeping them safe. But on top of that, they're going to be getting treatment as well.
Okay, so how are staff supervised and coached?
Awesome. So we have a great leadership team. So we like I said before, we review every incident that happens and we debrief with the team so that they are kind of getting constant coaching. But we also have shift leads, assistant program directors, and a program director that gets on the floor and does kind of like real-time audits and can tell the staff, hey, these are your strengths and here's where you can maybe make some improvements, which is great because you see these people that come in with this awesome skill set, but they may have a little bit of struggles in, holding a boundary or something like that. And you get to kind of coach them through that and see them grow as well. So from an administrative standpoint, we're growing staff and we're helping kids. It's kind of a win-win.
Yeah, that's awesome.
Yeah, so they're constantly monitored. We have like a monitoring system where the staff proves that they're monitoring the kids, and then we can prove it by looking at so we're monitoring them, who's monitoring the kids. That was a weird way to explain it, but
yeah. That's awesome. And from what I've heard before too, there's quite a vetting process of who's being hired.
Oh yeah, so like really in-depth background checks, reference checks, like they have to meet state requirements in regards to anything that's happened in their past. And then I think we have a really great team, again, at identifying the staff's why, and if they're there for the right reasons. We only want people that are there for the right reasons, period.
That's cool. I love that. That's fantastic. What is inpatient slang, and what does something like booty juice mean?
Okay. I actually love that we're asking this because I think parents, again, it's like that movie Hollywoodized what a inpatient hospital is, and they hear their kids say, hey, I got booty juiced and they just held me down, and they use this like slang amongst the kids that is so far from what actually our process is. And I think it scares parents. So I know, like, even on like our Google review, somebody got on and said they hold your kids down and they give them booty juice. And that's scary. That's scary talk for something that's super therapeutic. I mean, we've just talked about how that hold can be so therapeutic. And to have someone describe it in a different way can be really scary to a parent who's never witnessed that. Me personally, as a parent, I would never want to say that my kid got injected in the rear end without their, against their will, things like that seem super scary, but there's actually end up being so therapeutic, really therapeutic. So the kids talk, they sometimes use it as a badge of honor. There's like the little microcosm of who's in charge, within the clients. So sometimes they'll be like, oh, I got booty juiced, and you're like, let's use the real words for it. What happened? And they're like, well, I was being a jerk and I did hit, and then they'll actually verbalize what actually happened. So I think it's important for parents specifically to know that there is some scary language, but that's not really
Yeah,
what's happening.
Is booty juice essentially then just the last resort, like medication, like shot injection?
Yes, again, we have like an escalation model that like if they're fighting in the hold and they're just completely unable to do it themselves and with someone coaching them, then we'll do a medical intervention. And it's pre-approved. Parents know. It's not like we're doing it without their knowledge. We pre-discuss it at admit that these are some of the things that we'll use. And ultimately the kids respect it, and sometimes they're like, oh my, that's exactly what I needed. Which is funny. They won't ever tell you in the midst of it, but they'll tell you later that that's exactly what I needed.
You have to have that stuff there as well.
Oh,
You know
yeah.
what I mean? Like that's like your wishful thinking, if you know what I mean, if like there's not something to utilize and a tool to utilize, medication to utilize when it does get out of control and they do need a hard reset.
Right. And that's ultimately that's why they're there, because we have these additional tools that you don't have at home. You don't have. Those are the things we can use when it gets so bad, but they're they're limited use. It's not like we're using it every day, and most of the time we're not using it on the same kid multiple times. It's like kind of like it just is that conduit to change. And it's interesting, and it's a big blessing that it's even something that's available, because they need it, especially kids who are trying to harm themselves.
Yeah.
And can't stop and don't know how to stop. And it will stop them for a time so that we can get them to their brain space to talk through it. So
is there sexual contact between clients?
Yes. So this is sticky. We're co-ed. Obviously, they don't share rooms, and we have different units, and we try to keep them away from each other that way. But we feel like it's super important to program co-ed. Life is co-ed. So I feel like when you separate kids too much from what's outside of the normal, then when they get back to that, they don't have the coping skills to deal with someone that they're attracted to or deal with someone. So we set some really hard lines and boundaries on the front end. Does it happen? Yes, sometimes it does happen. We're very serious about not allowing. And part of it is that nonstop monitoring. We've had staff sit in between kids or talk to them. Again, it's kind of that same thing. If it keeps happening, when we were talking about bullying, if it keeps happening, we have like an escalation model. Obviously, if it's severe sexual contact, there's like just zero tolerance, separated. We even have to call CPS, and it's a whole big thing. So we work really hard on the front end to keep things appropriate. Our basic rules are you don't touch each other, period. Like we can do fist bumps and high fives, and that's pretty much it. So even if a client is hugging another client out of friendship or whatever it is, we are separating them immediately. Like, sorry, no, you can give the fist bump, and that's about it. So there's a lot of redirection that goes on. Kids are sneaky, and stuff happens, and it's unfortunate. But we are working really hard to prevent.
Yeah, I love that. And I love that it's a question that you are responding to, because like so many people don't even want to mention it, or that, companies will try to avoid something like that. But it's like, no, we know it exists. And
you're silly to think it doesn't. And are there additional precautions that we could put in place, like the kids not programming to get, like at a hospital, for example, they keep the kid in their own room and they don't have contact with, and we're trying to get them back. We're trying to stabilize and transition, and so we hate to take all of that away. We do have like precautions. So if we know someone is struggling like with sexually acting out, we'll put precautions on the front end and put additional interventions to help prevent. So we use every bit of knowledge, and we use that to prevent.
That's awesome. Is being in a co-ed environment safe for my child? Which is kind of the same.
I think the answer is yes. I want to say yes. I know that it can be scary. I think they learn so much more by being co-ed and programming together. I really do. I've seen the outcomes. I've seen people who have issues where they have learned behavior or something, sexually acting out. I've watched them change those behaviors because they're in in a setting where they are prompted to and have to on a regular basis. And so we do our best to not mix where it would be not conducive to therapy, if that makes sense. But it's way better to have them together. Way better.
Yeah, I think, and speaking with, some of the other staff as well, it's like this is trying to set them up to succeed outside.
I really think the reward outweighs the risk in this situation, especially when we're being so diligent in trying to prevent it, because we do know it exists.
That's awesome. The worry of, will my child be influenced by someone else who has more severe issues?
Is this weird that my answer is going to be yes? It's the same thing to me. It's like, are they going to maybe see something that they wouldn't have seen at your home? The answer is yes. Are they going to learn some skills to help them deal with things that they wouldn't have gotten at your home? The answer is yes. So to me, they are there for a specific reason, and we are going to focus on their treatment plan and their goals and their treatment. And we tell that to them. And we're here focused on you. Don't focus on them. They may see something. They may model something that they see someone else do. Oh, I didn't know you could scratch your arm and self-harm. They may pick up something like that. But again, we're in an environment where we can immediately redirect, teach a skill, intervene. Where if they saw it on the internet or something, they don't have a team that's there to help. So it is a little bit of a taboo thing, and people sometimes are like, I don't want to put my kid in somewhere where they're going to learn more bad things. And I think, where are you at? Can you handle this on your own? And if you can, then do it at home. But if you can't, this is the exact right place.
I love that.
The exact right place.
That's awesome. But how do you guys maintain or keep an environment that's positive and not scary? Because I think, already just being sometimes away from home, is a scary thing that any kid will go through.
Yeah, you're coming with fear, period. I think the activities that we try to do, the relationships we try to build, really puts a child at ease. I have not had a lot of kids, I think I've seen a lot that have come in scared. They don't stay scared. I think once they get to know us and why we're doing what we're doing it for you. We're not doing it to you. So they'll feel that, and they realize, even when they make a mistake, we're not mad. We're not throwing you out. They're sometimes used to that. They're used to acting out and getting thrown out. And when we stick through it and they act out and we're still there, it builds this relationship of trust that you can't really get other places. The school can't keep you. You know what I mean? You can't do things in your home and get to stay there, but you can stay here, and we'll work through it. And they start realizing these people are committed. And I think the fear leaves. A lot of times we get the opposite, where they are afraid to go home.
Interesting.
And so we have to work really hard on that. Sometimes they'll be doing so great, and they'll be working through things, and they're very accountable, and they have learned great skills. And now it's 2 days from when they're transitioning, and they start to escalate again because they're afraid for the next step. And so we try to build for the next step too, and say this applies to what you're going to do out there.
Going on with that, because you said they're more sometimes afraid to go back home because they love us so much.
Yeah.
You mentioned a little bit too about the beds being really nice.
Yeah.
And that stuff. Maybe describe the environment. What's it generally feel like? Does it have a school vibe? Does it feel like a hospital vibe? Or
so we have different levels of care. So we have a hospital, and it has to meet hospital criteria for infection control and those types of things. So it's a more sterile than we'd like it to be. And also the acuity of these kiddos, they are hard on things, and it's out of their control. It's a mental illness, right? So they're hard on things. They use things inappropriately. So our hospital side may feel a little sterile, because we're just trying to get them to focus on therapeutics and not any other stimuli. But as we move through, it gets more home-like. And that's kind of the vibe we want, is that like, here's your TV, here's your everything. This is like home. Obviously, it will never feel like home because you're not with your family, but it becomes a different kind of a family. And so we work on especially as you're going through the different levels of care, now we have a carpeted bedroom and all these things. It becomes less sterile.
That's cool.
So it's kind of a win-lose, because we would love to make it so cozy and so spa. I want it to be so spa-y, but they're just not quite ready.
Sure.
They're not quite ready. You have to take really good care with them.
That makes sense. I think that's awesome. What should parents know before sending a child to inpatient care? Like, what's maybe something like either a common question, or like, hey, this is really good for you to know because some people are concerned about it?
Yeah, I think the biggest things are the type of interventions that may have to be used, including holds and including medical interventions, which I think we're really clear on the front end, and sometimes they're grateful for because they haven't been able to do that on their own. Another thing is that is kind of what we talked about a little earlier in regards to like a communication break. Like, that's going to be really hard for you as a parent as well, but I promise that it is so good just to have a minute to reset you in your mind, have a little space, get a little rest, and then we're going to come back and fight tooth and nail to get treatment. It seems counterintuitive to have a break because parents want to be involved with their kiddos, but it's such a good thing. So that would be one thing. I also think sometimes they're misled, and I don't know whether it's by who admits them, but how long it's going to take. So we're this weird in between, like a hospital's 3 to 5 days, a long-term residential is a year, and we're like sitting at that month mark. So sometimes they're expecting really short stays, sometimes they're expecting really long stays, and so then they get kind of confused. So we're trying to get long-term stay outcomes in a shorter amount of time. And I think that's important to know.
Well, that's awesome. I think it's good to know too, because I feel like, yeah, you might have. It's the understanding that, hey, we have intentionalized every aspect of this. That
Yes.
staying any longer is
It
actually
starts
going
to
to be
be-
more detrimental.
Yeah, it's counterproductive
Yeah.
at some point. They kind of plateau out, and then they need to get out back to where they need to go. If they stay too long, then we start seeing them sort of regress. So it's that you explained that perfectly. Yeah.
That's awesome.
I'll just throw in one more time, like, we also offer alternative treatments. So the hospital isn't going to offer cutting edge like ketamine or TMS or hyperbaric chamber. Like, we have things. Sometimes these kids have been through all the meds. They've been to a long-term program. They're just at the end of anything you can do, and we even have more that we can offer. Let's try this. Maybe this will make a difference. And it has. We had a client who had been in long-term treatment for a long time, and she was on her second stay with us. So she was very resistant, and not personality resistant, but just resistant to, in whatever way, shape, or form, from her diagnosis. And we ended up doing ketamine, and it changed. She changed. It was like she flipped, and we were so grateful that we had that opportunity. And then she called us, oh, I've just made the lacrosse team. I'm doing so well. Her parents are like, she messaged us a year later. She just graduated high school. Like, what if we would have just stopped and not offered something that's not, because it's not covered by insurance, and it's kind of more experimental. But God, when you're a parent, you're like, is there anything else? Is there anything else we can do? And we think, why not? Let's try it.
That's cool.
Yeah.
That's cool that people can expect that. Expect everything.
Yes.
What is one thing that you want parents to take away?
I think I said it earlier, and you are making the right choice by allowing them to have this type of treatment. It can be expensive. It can be emotional. It can be so hard, and we're not promising a perfect outcome, but we are promising that we've tried everything. And you can say confidently as a parent that you've tried everything and that you have gone to the nth degree to help your kid. And I know as a mom that I would do just about anything to help them. And you see it in these parents' eyes every day. They are just reaching out for help, and they're willing to do whatever it takes. And we are trying to make it so it doesn't have to be so expensive. We're like getting insurance coverage and all this stuff so we can try to get, and we're doing it in a shorter amount of time, and we're trying to do everything so that it helps you as a parent. But it's their lives. Like, don't shy away from it because you're afraid, because the outcomes are there. And it may be a step-by-step outcome. They may leave a little more stabilized and have to do further treatment, but even that is a step in the right direction.
That's awesome.
Yeah.
Danielle, thank you.
Thank you.
Yeah,
this has been really fun, actually.
And where can people find more information if they have questions?
Yeah, our best is just our website, vivetreatment.com. We have our admissions people are incredible, the most loving people you'd ever meet, and they will talk to you about anything. Even if you're just kind of thinking about it, call them and they'll talk you through it and say, yeah, this is a good fit, or here's some other options that you can do. So I say call even if you are questioning a tiny bit whether you should come or not.